bursitis, the inflammation of the bursa, which are present around the knee joint. Hello, I'm Dr. Mohit Arora, consultant orthopedic surgeon, currently practicing in Gurgaon. So today in this video, we'll be talking about bursitis, the inflammation of the bursa, which are present around the knee joint. The first is pes anserinus bursitis, wherein the patient will have pain on the proximal tibia, on the anteromedial aspect. It is basically, there is a bursa called pes anserinus, which is formed by three muscles, which are sartorius, gracilis, and semitendinosus. So sometimes there is an inflammation of that bursa, specifically in diabetic patients, wherein sometimes their sugar level shoots up and that causes inflammation of the bursa. So the important thing is to differentiate, because as it is also present in an older age group. So important thing to differentiate it with degenerative osteoarthritis of the knee is it is usually down 5 centimeter down the medial joint space. There is a specific point of tenderness wherein the patient will point out that there is, at the site of pes anserinus, there is a pain, and usually the knee pain, the osteoarthritis pain is not that much. Now, the other thing to rule that out is proximal tibial stress fracture. In that case, we tend to take a proper history, examine more about the knee, and then MRI should lead to us to a correct diagnosis. So the management of pes anserinus bursitis is mainly conservative means: rest, ice, compression, and limb elevation. And if the patient sugar is controlled, then we can give them a steroid injection around the site of bursa to relieve them of their inflammations along with analgesics. Now, the other condition that can happen, around the knee is semimembranosus bursitis, which is basically present at the back of the knee. So in that case, semimembranosus muscle, there is a bursa and that gets inflamed, and usually the patient will complain of the at the back of the knee on the inner aspect. So it's basically a posteromedial aspect of the knee. The pain will be there along the insertion of the semimembranosus muscle, and the management is same as pes anserinus bursitis. MRI can help us to actually diagnose that condition, wherein you will find a fluid along the semimembranosus muscle, and we can also give steroid injection if the patient is not getting relieved by conservative means. Now, there is another condition called as prepatellar bursitis, wherein there is a bursa formation at the front of the patella. So there is always a bursa present there, but then it gets inflamed and there will be a lot of fluid accumulation. So the same management, conservative. Then if the patient is not getting relieved, then we can do the aspiration and steroid injection, and then even after that, if the bursa keeps on forming and troubling the patient, then we can do a surgical excision of that bursa. Thank you.